Hi, this is a toolkit guide for post-rape care and support services. Support after sexual violence. If you or someone you know has experienced sexual violence, there is help available through the OIC and at a Tutela Care Center 24/7 in a safe and caring space. Here are some key information points. Contact UCT-CPS for on-campus safety or support after hours. They can assist you with getting to a Tutela Care Center. Try to go to the Tutela Care Center as soon as possible. The timing to receive medical treatment matters. Go within 72 hours of the incident occurring. At the Tutela Care Center you will receive counseling, containment and appropriate support if you would like to report the incident to the South African Police Service. We encourage you to make contact with the UCT Survivor Support Specialist as soon as possible for psychosocial support, safety implementation and ongoing reporting support. More about the Tutela Care Center. All their services are free and confidential. You can receive medical treatment, emotional support and reporting guidance from them. This all happens in one place, which is specifically designed to support survivors with dignity and compassion. The nearest Tutela Care Center to UCT is Victoria Hospital. We recommend you call the receptionists on 021 799 1111 to let them know you are coming to reduce waiting time. The TCC is a small quaint building next to the main hospital. The address is Alphen Hill Road, Wynberg. To activate support, call CPS on 021 650 2222. Press the GBV prompt for your call to be prioritized. CPS can facilitate immediate services like physical safety, contacting UCT paramedics, student wellness night nurse, and transport services. We encourage you to reach out to a trusted friend, family member, student leader, or staff member who can be present with you in this moment and at the TCC. Before going to the TCC, try to keep the same clothes on from the time of the incident and avoid washing your body right away. There are shower facilities at the TCC for you. If you have already changed, please take the unwashed clothes you had on, or any other items like bedding, used tissues, or condoms, etc. in a pillowcase, paper bag, or newspaper. Do not use a plastic packet for these items because it may destroy forensic evidence. Getting medical care within 72 hours can make a critical difference. In that window, emergency care can help reduce the risk of HIV through preventative medication, PEP, prevention of pregnancy, treatment for other infections and injuries, and collect forensic evidence. After 72 hours, some options, like effective HIV prevention and emergency contraception, may no longer be administered. A rape kit can be examined up to 5 days after the incident. However, retrieval of forensic evidence may be impacted. Seeking care does not mean you have to report to police. It's about protecting your health and preserving your choices. It's okay to feel overwhelmed, but reaching out for care is a powerful first step toward healing. What to expect when you arrive at the TCC. A nurse will check your vitals and immediate injury care. Then you will speak to a caring counselor who is available to help you understand what is happening and begin processing the trauma, so that you can make an informed decision on your medical treatments, rape kit, reporting options and ongoing counseling. The counselor will explain to you your options of reporting to the South African Police Service. You can get supportive documentation like sick notes for academic purposes from the doctor or counselor. You will receive the medical interventions based on what you decide. If you choose to have the rape kit administered or want to report to SAPS, you don't have to go to a police station. The TCC can arrange for a specialized trained police officer to meet you at the TCC, and the counselor can remain with you during this process. If you choose to have the rape kit, forensic examination, an inquiry will be opened with SAPS for record purposes to store the forensic evidence, but no investigation will occur and the perpetrator will not be informed of the report. You may at any point choose to request for the matter to be investigated for criminal prosecution against the perpetrator. Remember to take down the officer's name, surname, and contact number for any follow-up questions you may have. At UCT you don't have to face this alone. The OIC can support you every step of the way. Contact the survivor support case officers through creating an OIC case file using the QR code or accessing the link on the OIC website. The OIC offers trauma-informed psychosocial services that can help you feel safe on campus, psychologically and physically, as well as guide you through the options for UCT reporting processes if the person who harmed you is part of the university community. We know what happened is not your fault,
and we want to remind you that your safety, your healing, and your choice matter. This is why meeting with the survivor support case officers are not automatic UCT reporting processes, but engaging with the OIC does uphold the legal mandated reporting requirements for the matter to be recorded safely. You may choose to connect with the OIC whenever you feel ready, even if it is only for psychosocial services, regardless if the perpetrator is affiliated to UCT or not. You don't have to have everything figured out, just starting the conversation is enough. We will follow your pace, and you stay in control.
At the OIC, we prioritize survivor safety, agency, needs, and well-being. It means listening without judgment, respecting the survivor's autonomy, and allowing them to decide what steps to take, whether that's seeking medical care, reporting the incident, or simply getting emotional and academic support. Thank you for going through this toolkit. Let us continue as a community to empower survivors, not pressure them, and to create a safe, respectful space where they feel heard, believed, and supported.